Hey there, Mr. B again. All right, we're still in the first week. So let's talk about the thing that we talk about in nursing. I've been a nurse for 38 years. Always talk about it. Talk about it all the time. Do it I don't know how many times a day. Maybe 50, 60, maybe 100. Hand hygiene. Washing your damn hands. We're in a pandemic. The one thing that we need to do frequently and often is wash our hands. Okay, it's not an option. Um, you want to keep your nails short. You want to keep them clean. Are they clean? Oh, good. Okay. You want to keep them clean. Okay, very important. Person, nurse, female, guy, anybody with dirty hands, doctor, surgeon. You come near me with dirty fingernails, I'm running away from you. Okay? Stay away from me with dirty fingernails. Now, some people have difficulty keeping their nails clean. Mechanics, they have a hell of a time keeping their nails clean, but some can do it. Gardeners have a hard time because their nails are always in dirt, have a hard time doing it, but some do. Anybody else? You ain't got no reason. You ain't got no excuse. You really have no excuse for keeping your nails dirty. If you take a shower every day, you don't even have to clean them and they'll stay clean. But anyway, so nail polish. Nurses, if you wanted their nail polish, save it for, well, right now we're social distancing and we're kind of sort of not out in places, bars, etc. Wear the nail polish for the nice occasions, the weddings, the parties, the etc. Don't wear it to work. Long artificial nails. Well, most hospitals they're banned for healthcare people because you know why? Those long nails, those artificial acrylic nails, a lot of bacteria underneath them. You can't clean no matter how often you wash your hands, all that dirt and that gunk is still up under there. And so when you touch your patients, especially your infant patients, they get that bacteria, they get sick and they die. There have been studies done about that. So nurses don't wear acrylic or artificial nails. Most hospitals don't allow them. Tell them, excuse me, normal or nothing. So if you got to wear nail polish, wear something clear. Wear the purple stuff, the nice stuff, the cute stuff. Wear it at your leisure. But when coming to work, make sure you don't have that. Okay. Um, Wristwatches, arm sleeves, when you're washing your hands, move those things up. If you have jewelry on, take it off. Honestly, you got a nice diamond ring or a really nice, beautiful wedding band, leave that shit home. Okay, because you're going to take it off in the bathroom, you're going to set it down, you're going to wash your hands, spend 15, 20 seconds, 45 seconds washing your hands, and emergency is gonna come and you're gonna run out and leave your damn wedding ring or engagement ring or whatever in the bathroom and forget about it. You think that shit's gonna be there when you come back? Leave your nice jewelry at home. Okay? If you're only working 33 days a week, 36 hours, leave it at home. Even if you're working 40 hours, leave it at home. Wear it on the nice occasions. Wear it at home. But you don't want to do that. Okay. Um, we use antiseptic hand rub as long as we haven't touched wet stuff. All right, so as long as you know you've touched something dry, you're good to go. The minute you put your hands in something wet, you need soap and water. Period. Because wet stuff, especially in a hospital, you don't know where that wet stuff been, or many times you know exactly where that wet stuff has been or where it's come from. But before you really put your hands in anything wet, knowingly or unknowingly, when you touch a patient, you should be putting gloves on. So when it does get wet, it's on the gloves. You just take the gloves off and then you can just go wash your hands. You got to think about these things ahead of time. Now, sometimes in emergencies, patient is vomiting or, you know, they just started to bleed out or something. They had sutures or whatever. You don't have time to put on gloves. You just have to react. But 9 out of 10 times, you have a moment to pair on a pair of gloves before you go ahead and touch wet stuff. Okay, so let's move on. Basically, you want to start the recommended amount of product per manufacturer's instructions. Um, Put it in the palms of your hands, whatever it is. We're talking the alcohol stuff. You put it, a drop of it, put it in the palms of your hands, and then you start to rub your hands together, covering the antiseptic solution in the palms of your hands, on the backs of your hands. You interlock your fingers. I always do each finger at a time. You want to clean your thumb areas. You want to finish with your wrist. Okay, so, and I do it basically until the stuff kind of evaporates. So you want to allow your hands to completely dry before putting on any gloves, because if you try to put on gloves after with your wet hands, ain't happening. The gloves are just not going to go on right, and it's just going to be a mess. Okay, so make sure your hands are dry before you put this stuff on. Okay, using soap and water, whole different selection. Now remember I said the antiseptic alcohol stuff you can use as long as you've just touched stuff and you haven't come in contact with wet things. Or if you've had gloves on and you touch wet things and you can't get to a sink right away, you can use the antiseptic as long as the wet stuff hasn't touched your skin. But otherwise, you want to use soap and water. All right, and even if you have gloves on and you touch wet stuff, you really want to get to soap and water as quickly as you can. But if you can't, you can use the dry stuff. Personally, I like to go to straight in soap and water, but usually in the hospital, before you go in the room, you gel up. When you come out of the room, you gel up. You may have to wash while you're in there, but you're still in and out. You gel up in and you gel up out. All right, so you stand in front of the sink with the water. You keep your hands in your uniform away from the surface of the sink. Really important. You can go to some nursing departments and some hospitals, and the sinks are just a mess, because nurses aren't necessarily all that clean sometimes. So you want to be careful that your uniform is not touching the wet stuff. So you basically stand in front of the sink. You keep your hands in uniform, as I said, away. You basically turn on your faucet. You can either use your foot or your knee if it's old school. Most faucets today, usually you kind of put your hand under and the sensor kind of turns the water on. So the first thing you want to do is you want to get your hands wet, not splashing on your uniform, but just kind of get the hands wet, get the flow of the water, make sure the temperature is warm. I don't use cold water. You shouldn't use cold water. You should at least use tepid or warmer water to wash your hands, which will help to get the germs off. So you wet your hands basically up to the wrist, and then you apply a gentle amount of soap onto your hands. You want to create a friction in that whole process. You want to get a nice lather going on and a friction. And in the normal world, 15 seconds is good. You can sing Happy Birthday, which is kind of a cool song. That's about 15 seconds. In the COVID world, you should do at least 40 seconds. 40 to 45 seconds, so that takes a little bit longer, so you might have to sing Happy Birthday about 3 or 4 times to sort of get to it, but you get what I'm saying. So you wash your hands gently with the lather. You get that friction going on. You interlace the fingers again, and again, I do each finger. You should do each fingernail as you go through as well. Get the backs of your fingers. Get a nice friction, circular motion going on. Doing that for, as I said, Happy Birthday is a good 15-second song. You'll do it about 3 or 4 times for COVID, for at least 40 to 45 seconds. So then at that point, you get your fingernails all nice and clean. Then you go ahead and you rinse your hands thoroughly, always keeping your hands going down. Rinse them nice and thorough. Get all the soap off of them. And then you can grab your paper towels and you can start to pat your hands down. getting them nice and dry. Then you will, or you can use an air dryer, which actually is really better because you just stick your hands up under the air and you do it. But you'll grab a paper towel because you will not use your now clean hands to turn off the faucet. So you'll grab a paper towel to use that to turn the faucet off. And then you will dispose of the paper towels in the appropriate place. Okay, so essentially, again, there are videos to show you how to do this. I want you also to show me how you wash your hands by doing a demonstration video so I can actually see how you do it. And I want you to go through the steps, but we're going to get together and we're going to talk about the steps anyway. Okay, so after you've done that, you can use whatever organizational lotion that they may have for you to wear, because you wash your hands so many times, they're going to get chapped, they're going to get dry. You want to use some kind of hopefully non-scented lotion that is good. However, if you're going to take care of another patient next after you just wash your hands, you don't want to use any lotion because you're going to have trouble putting your gloves on. Okay, so you'll gel, make sure that's dry, put your gloves on. Work with your next person. Okay, I think that kind of covers the hand hygiene part. Okay, we'll see you at the next video. Bye.